Do you think your child is too young to deal with stress? And that's often the case. But there's no such thing that of a stressless life. No matter what age you are, no matter how difficult it may be, we are always dealing with stress. And being a child, a teenager, preteen, doesn't make a difference. What makes a difference is how do we manage that stress? How do we teach them to manage stress? How do we teach them to cope with stress? Because one thing for certain is that all people, whether child or not, deals with some type of stress. Now, my name is Taharka Sankara, and I'm a licensed clinical social worker. I'm a licensed clinical alcohol and drug counselor. And I also deal with some trauma-focused cognitive behavior therapy. And I'll tell you that I oftentimes deal with children that have difficulty managing stress. Now, stress can appear in many different ways, and it can affect their mood. So if you're ever dealing with a situation with your child, the first thing I would suggest that you do is look at what type of stressful situation or stressor that they may be dealing with, because it may be an event, it may be a series of events that they're experiencing that is causing them to feel stress. And stress can affect them in many different ways. It can affect their mood, it can affect their attitude, their focus, their patience. And if you're not careful, it can often result in your child being diagnosed or misdiagnosed with a mental health disorder, such as anxiety or depression. So I'm going to tell you, there's about 4 different types of stress, or different levels or degrees of stress that someone may go through. And to start off, there's something called eustress. Now, eustress is a good type of stress. A positive stress is the type of experience that we go through when good things happen to us, like we get a good grade in school, or we have a new child enter into the family. So I have a new sibling, so I'm excited about that. Or my parents may get married, right? Or some good event happens and it increases my stress level. There's a holiday coming around and I'm excited, I'm anxious, and I'm constantly thinking about these good things happening. So that's what's called eustress, right? Or good stress or positive stress. And then there's a heightened level of stress, which leans more to the negative side of stress, which is known as distress. And it's a situation that happens, an event that happens that causes some slight worry, some frustration, some irritability, and we may have a difficulty managing, but it comes, we can eventually process it out, we can get through it, we start to refocus and get to some other things, and it no longer becomes a problem. And that could be something like studying for a class or a test, or even failing the test at school. And that may cause some distress, some anxiety about how am I going to manage this, or is this grade gonna devastate my entire year at school? How are my parents gonna react to me having a failing grade? So this can be a situation of distress. And again, it can easily be managed, it can be worked through, but it can influence the mood, it can influence the attitude. And then there's a heightened level, again, of what's known as acute stress. Now, these are more prolonged, short-term stressors that happen. They may be more recurrent, and it creates more of a complication in many of our affairs. So it could be something like a divorce happens in our lives. We may experience a death in the family, and it becomes more strenuous on us. It may have more of a debilitating effect. It may make us not want to eat. It may make us want to sleep too much. It may just influence us to not be our normal selves. But these, again, are short-term, they're short-lived, but these can be more problematic. We may find ways to cope with it that may not be healthy for us. It may not be healthy for our family dynamic. We may lash out. So if your child is lashing out, they're becoming more argumentative, they're not listening, you may want to consider what types of stressors are we going through as a family in our parent-child relationship. What are some of the things in the environment that may be influencing this stress? Is it peer relationships? Because that's a common one. Is it social media activity? Is it video game play? What are some of the things that's influencing and creating these types of stress in my child? Because if we don't manage this properly, it can lead to some things that are more challenging and some things that are more complicated. And lastly, I would say there's a higher level of stress known as chronic stress or toxic stress. And these stresses are things that happen to us, an event or a series of events. But after the event has gone, after it has passed, it could be months later, we're still reacting. So your child may still be reacting to this stressor. So a chronic stress is something that happens, it goes away. However, we continue to experience it as if the stressor is still there. And this is where it becomes more of a diagnosable condition. And again, it affects your mood. It affects your child's mood. They may have anger outbursts. They may have argumentation. They may find themselves difficulty with concentration, with focus, with studying, with paying attention. Their patience become more irritable. You may ask them to do something and they're reacting to it in an inappropriate way. Again, it may result in them, if you seek professional help, it may result in them being diagnosed with some type of mental health condition. But I strongly advise you, rather than go with a quick diagnosis or allowing your child to be labeled in this type of way, I really want you to consider the fact of what is the stress in my child's life? What is the stress in our family life? What is the stress in our family relationships? Because all of those things are manageable and you can find different ways to cope with them to better help your child. Now, I opened up a group called Next Gen Parenting, and I invite you to join, where we could look at some of the things that may be affecting your parent-child relationship, such as stress and how it affects your child. And you don't have to necessarily be a parent. You could just be an adult and a responsible adult that deals with children. You could be the grandparents of your grandchildren, and you notice some things. But we want to look at this as an opportunity to learn and grow, develop some knowledge, increase our knowledge, develop some skills and some strategies of how do we better and more effectively parent our children. Because the problem that you may be dealing with, it may not be anxiety, it may not really be anger, it may not be depression, it just may be stress that's not being properly managed. And so I encourage you again, I invite you again to join Next Gen Parenting Group, where you get an opportunity to work with me, speak with me, and also engage with other parents. And again, this is not about me telling you about what you should be doing as a parent, how you should be parent. It is a village that we get an opportunity to share in and engage in and help each other out through our parenting experience. So join the Next Gen Parenting Group, and I look forward to seeing you on the other side.